Hi, everyone, and welcome to another one of our little New Leaf chats where I kind of pick the brains of my practitioners that work at New Leaf or other wonderful people that we know. And today, very excited to have a conversation with one of our New Leaf practitioners, Jiayen Nomchong. She is an accredited practicing dietitian and a qualified naturopath as well. So she comes with a whole bunch of experience. She's been part of the team here for a while, which is great. And we love having her because she brings a slightly different approach with that definite New Leaf vibe to what she does. And some of the work she's been doing is on metabolic health and a non-diet approach to that. So we just thought it's such an important conversation to have, and we wanted to have it with everyone today. So, hey, Jai, thanks for having a chat with me.
Hi, Hannah. Thank you for having me.
So let's have a chat about what you do. So tell me a little bit about you being a dietitian and a naturopath, and how did you put up with that much study to get there and do that? That's a lot of study.
It is a lot of study. I've actually done 2 degrees and a master's, so it's actually a lot of study. I studied clinical nutrition, and then I went on to study naturopathy, and then I went on to study dietetics after that. So it was many years, but I found that when I was studying naturopathy, that I loved it. I mean, naturopathy is, I feel like, my foundation, but I found that there were a lot of, I guess not issues, but it's quite expensive to see a naturopath, and there was something missing in that scope. And I've always loved nutrition. I'm food first as a practitioner, and I've always wanted to be a dietitian. So I went on and studied to do a master's in dietetics so I could reach more people. As a dietitian, it works under the Allied Health, and I love being a dietitian, but I also love being a naturopath because I love herbs. They're incredible.
I love it. I know when I speak to nutritionists or when I speak to people who are studying nutrition, I know that naturopathy study is a little bit, it's obviously more study. And I go, don't not learn the herbs. The herbs are just like the most beautiful part of what we do. So yeah, I think it's great when people go on and do the Bachelor of Naturopathy after the nutrition, but then going on to do a master's, I can't think that many practitioners go and do that. So well done. And I guess, one of the pillars of, philosophy that we have here at New Leaf is always looking at that individual patient, trying to look at them through that non-diet, non-judgmental phase of their lives. Like women and men and all people are inherently more self-scrutinizing themselves when it comes to weight, when it comes to diets, when it comes to the shoulds and they shouldn't. How has looking at the world of that really influenced the work that you do with your dietetics and your naturopathy? Like, how do you work with your patients navigating that field?
Well, dietetics is very evidence-based, even though naturopathy is too, but dietetics works within frameworks. So when I'm looking at clients or I'm seeing clients, I'm looking at them individually, and the frameworks are just something to reflect upon. I mean, they do have foundation and they are evidence-based, but people aren't like that. People are individual. They've got their lives, it's complex, and no one person is the same as another. So that's where I feel it's really important to look at the person as a whole, which is where naturopathy comes in, but then also having that evidence-based foundation and the frameworks of dietetics to be able to bring that in as well. But non-diet approach is probably the core of where I practice. It's called HAES, so Health at Every Size. There's been so much evidence to show that long-term diets don't work. They're not sustainable, and especially for weight loss, and people bounce back to the weight that they were before. So it's really important to look at the person as a whole. Like, how are they living? What's their environment? What's their cultural background? How are they cooking? How are they exercising? What's their body composition like? Because we also know that BMI is not an accurate measure of health, and we can see that through culture. So I think it's really important just to individualize with each person.
And that's what I love about naturopathy, and what I love about what you do. I mean, because, when I refer patients to you, when it's relevant for me to see that patient to see a dietitian, you often get this kind of like, oh no, I've seen a dietitian and they just gave me a list of foods to eat and not eat. And I know that not all dietitians are like that, but the work that you do through that non-diet HAES-aligned approach is different, and it's not the most common approach that dietetics engage with. Like, why not, and how does that happen in that profession?
Well, dietetics has been around for a while. I mean, obviously not as long as naturopathy. Naturopathy is the foundation of health. That's where medicine comes from. But dietetics it's been around for a long time, and it's changed a lot over that time. And when I studied, it was a very prominent part of the masters was that we learnt about non-diet approach, and we looked at the evidence to show that diets don't work. And it was quite difficult when you go into clinical placements and you're talking to these dietitians that have been around for a very long time, and you're trying to implement this non-diet approach with them, because there is a lot of backlash about it, because it is about looking at the BMI, the calorie in, the calorie out, the exercise, and that's great if you're looking at something in a hospital system where you're looking at a malnutrition client, where you've got to do a feed or something like that. But when you're looking at a real life person outside of that chronic care, it's very different. And we need to adapt that based on who the person is. So, yeah, like I said before, diets don't work for weight loss. They just don't.
No,
So,
I mean, obviously when we're recording this, it's January, there's a whole bunch of noise out there about, what people should be doing. I'm very grateful for the patients that we see at New Leaf. They know that they don't come to us for that quick detox 2-week body transformation stuff. Like, we're working on the foundations of health and wellness, and they're there for the long haul of that stuff and understanding their bodies and stuff. So I think it's wonderful. But I saw a great thing today that said, if diets work, then you wouldn't be on your gazillionth one this January, and I think people forget that, because they go, well, surely there's a better way to do it than I'm doing it. And someone else whose body looks different from me, whose world looks different from me, they've got it sorted out, and it doesn't help that person engage in a change and understanding what's right for their body as well, and that's what that's what I love about naturopathy, and also love about the work that you do. So when you're looking at a non-diet HAES-aligned approach to health, particularly around metabolic health, which is your area that you love working in, what is metabolic health? Generally, how would you describe it? So when people hear the word metabolic health, they would know what that encompasses.
it encompasses the whole body and how your metabolic system is working. So it looks at, your blood sugar regulation, it looks at your gut health, it looks at your reproductive health, it looks at your immune function, and some common diseases that you would find in a metabolic situation would be, the type 1 diabetes, type 2 diabetes, gestational diabetes, PCOS, that sort of area. But it does have a lot to do with gut health as well.
And it is. I mean, it's a complicated condition because it does involve so much. And that's the joke I always make is, the hip bone's connected to the knee bone in the body. Everything is connected and joined together. So, you can't look at things out of isolation of other systems. And I mean, I guess, we do see a lot of perimenopausal women, and insulin resistance is such a huge part of what they're struggling with through that hormonal change. That for me, that's a really great example of how understanding body composition, understanding your ability to health and your metabolic health is not just about calories in, calories out, because it is actually so connected to so many other parts in the body as well, right?
Yeah, and there's a direct connection with, polycystic ovarian syndrome as well, because that's an insulin resistance too. So, and what comes to mind straight away is that women go through such huge changes throughout their life, throughout their 90 years, plus nowadays of life. You go through the infancy and the puberty, and then you may go through birth, you may go through, menopause, all of these different things. And as a woman, you need different structural health foundations through these different sections. And I think that's what is missing in a lot of practice these days, not necessarily in naturopathy, but more mainstream practice, is it's not really considered on top of the environmental and on top of the lifestyle and the diet and how you're made up. You know, everybody's so different. And we look at, you know, your genetics too, like what's your mother look like? You know, what does your grandmother look like? Like, is there a history of diabetes in the family? Like, do you naturally have a sensitivity to glucose metabolism? Like, is that just naturally in your family, which we can see? And if that hasn't been addressed, you know, in your mid to late 30s and going into 40s and early 45, 50, you know, your menopause picture is going to look very different.
And it's like knowing that timeline of health and how those nurture points, you know, just because everyone in your family had diabetes does not mean that you will automatically get diabetes, because it's about understanding the nourishment that you can change to support the genetic health and your environmental health as well. So, I mean, that's, you know, that's just like 101 naturopathy as far as I'm concerned.
Yeah,
that's the best thing for it.
Yeah.
So when you define metabolic health as a like non-dietitian and naturopath, like how do you do that beyond focusing on the numbers on the scale, on weight? Like how, like that is often a really sticky point for people because they get told by their doctors or their health professionals, just go and lose weight and you'll be fine. They're not taught how to, they're not taught, you know, they're not given much guidance on how to do that. But defining metabolic health that isn't just about scales, how do you do that to make people feel comfortable with the changes that they're making?
Yeah, that's right. I mean, what we would look at would be, you know, symptoms. Like, what are their symptoms presenting like within their body? What are their biomarkers? So what does their biochemistry look like through pathology testing? What's their behavioral consistency? What are their everyday habits like? Their food relationship? You know, and I think one of the most important things is quality of life. Like, what does that look like for them? Yeah, so these are the things that that I would assess in regards to what does it look like as a big picture, because that's a better measure of health than BMI.
Yeah, 100%. I mean, what does their, you know, their individual experience of life is, and is there more quality and more joy that they can find through learning behavioral change and understanding what's driving stuff? Because so much, particularly the women I see, you know, everyone we see here at New Leaf, we ask them about their relationship with food and how that is, and if that's something we need to be mindful of when working as nutritionists with them, which we all are here at New Leaf. It is so important to be understanding of where that person is on their journey and understanding of nutritional medicine. And I think that that is something that a lot of practitioners forget sometimes. You know, they expect like, well, I do all this stuff, so everyone else should be able to do it just as easily as I do. And that's just absolutely not true. Like our job as practitioners, and you know, that naturopath as teacher is to help people understand where they are and what tools they need that help them, not what helped me. You know, I always say we're not health coaches. I don't do this because I have the same experience as all my patients. I do this because I'm trained to be able to look at that individual person. And I think bringing that naturopathic vision to dietetics is so needed, Jai. Like it's so refreshing. But there's challenges with that, you know, like where are the challenges with that? Do you get pushback from people? Like, do people feel like you're doing something wrong, even though you know you're doing something right?
Yeah, well, I think what you said previously about people's experiences with dietitians, there's fantastic dietitians out there, absolutely amazing. And then there's, I guess, like every profession, there's dietitians that people don't align with. And so they might have a different experience with it. And so I've had responses where they've said, oh, I've seen a dietitian, I wasn't really happy with it. I feel like it was very quick, very cut and dry. I saw them in a hospital setting or I saw them in an outpatient setting and they just gave me a piece of paper that was based on, you know, a Queensland health guideline. And which is fair, you know, because dietitians in that space don't have a lot of time. And it's almost like that 6-minute medicine sort of thing with the GPs. You know, they've got 6 minutes to see a client and then they're ready to go. Dietitians in that space is like that as well. It's very, very quick turnover. So But when you get into a private practice clinical setting, you've got time, and you've got the space to really ask the questions and to really understand the person. And I think as a practitioner coming from both fields, I've got questions, and I've got questions that will lead on to other questions and things that maybe somebody has alluded to that maybe hasn't been picked up somewhere else. So it's about having that understanding and that knowledge of people, I think, and also having those two backgrounds, like what to ask with what question, I think, because it's all an investigation and it's about being curious, and as practitioners, we're really curious creatures. We want to know everything. We want to know every single little
Yeah, we're
detail.
so noisy, aren't we?
I know we are so not noisy,
We
nosy, so
yeah, we
noisy.
want all the answers.
Everything,
When I see a patient for the first time, I'm like, I'm gonna ask you lots of questions today, and I'm really sorry, but you can let me know if it's too much, but I just need to know everything about you. And I know you're coming for X, but we don't look at X without looking at everything. And it's one of a patient said to me the other day, she said, doctors has probably spent as much time with me in total over the past 10 years as you have in this one appointment today. And I can pretty sure say that you've learned more about me than my doctor ever has. And that's not just on doctors. They're under the pump. They don't have time we're privileged.
Yeah.
It's the way that we choose to practice is to spend time with our patients that way, which I love. And that's why working with allied health and working within the health mainstream means that you can pick up so much more on that patient's story, which then can help influence their health with all their other health professionals as well. So, it's good. Oh, I love the work we do. It's so good. So when you're working with your patients, like how do you track their health when everyone else in their world and their health professionals is tracking their weight, when TikTok's telling them about weight, when, everyone's, telling them metabolic scales to stand on and so, like, what do you do that's not looking at them getting on the scales? Like, how do you do that?
I look at their lifestyle, I look at their exercise level, I look at how their body's feeling, how strong their movement is, how they metabolize food, their energy levels, their stress, their sleep, all of those things come into play when looking at health in general, because it's not about a scale. I mean, you can be any weight and be strong and fit and healthy and active. I've seen clients that are, let's just say, really quite lean, but are very unhealthy. They've got these incredibly chronic conditions, and then I've seen people in larger bodies that are just doing, high intensity exercises. They're swimming, they're going hiking, and they're fit. They're really fit. So it's not really a marker of health. And I don't weigh my clients. I don't think it's necessary. And I think it also creates a bit of anxiety, especially with the fad of the weight loss world. It's just a number that, it doesn't really mean anything.
I know. And it's, when you went through that list of all the things that you look at apart from weight, you just go, oh, wait, there's so much more than weight that helps me understand my own health. Do you know what I mean? Those patients, like my energy levels, my sleep, my way my digestion is working. All these things are so much better indicators of health than just standing on a scale and looking at it. If there was one thing I could do, there's many things I want to do as a practitioner in my clinical life, but it's definitely changing people's attitudes towards their bodies and the shame and the way that they sit in fear of what they should be doing. And I think holding our patients' hands through that journey is just like one of the most important things we can do for their lives. I find it very important. Like, what do your patients feel different about working with you? Like, what do they notice that's different from maybe working with other practitioners in the past?
Definitely a feeling of safety and non-judgment. So I think because there's been such a long-standing marker of health of BMI and weight, there's a bit of a stigma. And so they may go to their GP and jump on the scales, or they may go to a dietitian and have to jump on the scales. But because they don't weigh, it creates an element of safety. And it's about education in reading your own bodily cues as well, like reading your hunger signals, having a healthy mindset, and also intuitive eating, which comes into play, which is really important. So teaching my clients about intuitive eating is a big part of my practice, because what I've noticed is that we are so far gone from having this very tight knit relationship with our body because of, social media, because of diet fads right through the 70s and 80s and 90s, the skinny situation, and this preconception of who we're meant to be as women and men. Men have high levels of disordered eating patterns as well. But we've forgotten how to understand our body, and we have forgotten how to read our body and to know it instinctively. And that's something that is very important that I teach my clients: how to read their hunger cues, how to read their thirst cues, how to read their energy levels, their sleep patterns, how to read their stress levels. Some people have a relationship with food where they reach for food when they're stressed, or they reach the food when they're bored, or whatever it might be. So understanding, like, why are you doing that? What is it that you're stressed about? And what are you actually reaching for? So I think it's really important to have a intuitive understanding of your body. I think just as a human, from when we're really little to when we're older. And you see children, and they do. They know when they're full. They know when they're hungry. They may not be able to articulate it correctly or in a way that, a grown-up or somebody in their tween years would be able to do it, but they know when they're sleepy, and we got to tap back into when we were kids and we remember that.
Yeah, there's it is true. Like teaching, as I said, teaching people to understand their bodies is like 101 of a naturopathic philosophy, I think. So, so important, so very important. Okay, so common myths on metabolic health. Like, I mean, I try not to doom scroll too much, but really, like the things I see, particularly in January, particularly this time of year, the rubbish. I mean, as a middle-aged woman, I am bombarded with the most crazy messages of rubbish I can't even see. But there is so much myths about what metabolic health means and the best way to achieve it. Like, if you could list a few of those myths and bust them, what would they be?
I think one of the biggest myths is that if you eat less and you've got very strong willpower, then you're going to have good metabolic health, which is BS.
And willpower, how do we describe this willpower for people? Like, is metabolic health just about willpower? Really, that's the assumption, isn't it, that they're making from that rather than anything else?
Yeah, it's not about willpower. It's not about eating less. It's about understanding your body. And if you've got insulin resistance, your body is going to be working differently to how it would have been if it didn't have insulin resistance. So you're going to get these, if you don't eat the right amount of carbohydrates or, healthy sugars, you're going to get these huge drops, and you're going to feel fatigued and exhausted and dizzy, so that's your body not functioning at its optimum. But if it was, then it wouldn't have that. So it's a huge myth to say that. But in reality, metabolic health is influenced by so many things, like stress, for instance. Your cortisol rises when you're stressed. Like, what does that look like? You're going to crave more sugar, and then you're going to have a spike in your sugar levels and your blood sugar levels, and your body's going to react differently. So there's so many different myths with it. Completely cutting out carbohydrates altogether if you've got insulin resistance in metabolic health is just crazy. That's a myth that has been going around as well. You need carbohydrates and you need to stabilize your blood sugar levels. It's about how much carbohydrates you have over the day and how to evenly disperse them so your blood sugar levels are even, and so you don't get these high and low peaks. It's about balance and stability and sustainability over a longer period of time. So probably they're the two biggest ones I see a lot.
Yeah, I mean, I'm not even going to get started on like intermittent fasting for women. I mean, we could do a whole session on that. We could do, there's so much to talk about in how we're looking for that perfect diet, that perfect way, which is going to there influence and make us the most perfect version of ourselves. And, there's so much care we need to give ourselves before restriction. And I think that that's such an important thing I just want all my patients to know that they're okay, they're all good. So, so much to talk about. So, I mean, I've already got ideas of what we're going to talk about next time we catch up, Jai. Oh my God, I've got so many things to talk about this because I think, making this conversation public is really important. It helps people understand that there is other ways to care for themselves rather than what they're seeing on TikTok and Instagram. I mean, yes, spoiler alert, I'll probably put this up on social media and hopefully people will see it and learn that there's help out there from people like yourself. So, any final comments you'd like to make before we finish up for today?
Yeah. So one thing that I always tell clients, and I feel like I'm on repeat a lot of the time, but it's something that I really believe, is small changes over a long period of time create sustainable change. It's not the big things all of a sudden 0 to 100 that work. Small changes. So when I'm looking at a client's diet or lifestyle, I look at a whole month. I look at everything they're doing and what is the bulk of what's happening and how can we streamline and make everything more sustainable. So changes, habits, all of it. So small changes over a long period of time make a better change.
Sustainable, ongoing change, and we want it to be lasting. We want to give our patients things that they can do forever. That's actually what is so important. So great. Anyway, that's Jai. She's at New Leaf. Come and see her. Come and see us. Send us a message if you need her. We're here to help. And we're going to keep having these conversations because they're helpful. So if there's something you want to hear from Jai or from me or from Jack at the clinic, you let us know. We'll talk about it and we'll go from there. So thanks, Jai, and I'll speak to you soon.
Thanks, Hannah.